Good morning, everyone. I hope you're having a great day. It's my weekly walk. I'm wearing my Croatia hat for you Croatia lovers. Absolutely love that place. Unbelievable. I have great stories about it. So today I'm going to talk to you about the 5 most common non-surgical eyelid rejuvenation procedures that I'm asked about. I'm going to give you my opinions. I believe they're all absolutely factual. And if you have questions, you can DM me. I think it's important to go over this because I'm asked all the time by patients. Sometimes it's hard to find the appropriate information on the internet. So let's see where this takes us. So let's start with number 1, and that's Latisse. Latisse is a topical application that's put on the eyelashes to make them grow longer, thicker, and darker. And it does. You will have a good result. You will not be unhappy. However, there are some potential side effects, and let's talk about those. The first is that the pigment of your skin, eyelid skin, can darken. The second is the color of your eye can change. So those with light colored eyes, sometimes they become darker, and this is permanent. And finally, sometimes the fat of your eyelids can atrophy, and you can become sunken and hollow. And so that's something you need to think about. So don't avoid this application if you want the improvement with your lashes. Just watch for these side effects and talk to your physician should you notice anything. Number 2, Upneek. Upneek is an FDA-approved medication that opens the eyelids and brightens them. What do I mean by that? It makes the upper lid pop up so your eyes are more open, you appear more awake, and it also makes the eyes whiter. Great combination of things. People love this medication. It's a once-a-day usage. And I think that it's pretty safe. And if it's something you're interested in, you're not losing anything. And if you have any questions, just let me know. Number 3, fillers. We've talked about this at length before. As you all know, I think fillers are a great and useful tool. However, fillers potentially have complications. I think the first time they're used around the eyelids, people do well, but it's on repeat injections that sometimes we notice color change, usually blue, and swelling, what we call edema. And it can be on the second time it's being used. It could be on the first time also, but usually on multiple uses. And if that occurs, you have to see your injector for some kind of treatment. Sometimes it requires removing the filler. So don't be scared of fillers. Make sure you're a good candidate. Talk about it with your injector and know the complications can occur. The next things we're going to talk about is PRP and stem cells. What do I mean by that? Well, PRP is a blood-borne product. We draw your blood, we spin it in a device called a centrifuge, and we take some solution out that has growth factors in it and can improve the quality and texture of your skin. Not a bad thing. It's done by injection. Stem cells are what progenitor cells, or cells that can become anything. And we can get them from many areas of the body. Most typically, we harvest fat and we prepare the fat in a certain way that it becomes nano fat, which has no viable adipocytes. There's no fat cells in it, just stem cells. Stem cells can do the same thing as PRP. They can rejuvenate the skin by injection. So PRP and stem cells are believed to help improve the glow, the quality, the texture of the skin, and make you look better. Also a great thing. Just make sure if you're looking into these interventions, you talked to the physician, make sure they have experience with it. They can show you some before and afters and make sure that it's right for you. There is a cost to this, and you have to make sure that the cost-benefit analysis works. I've also seen complications from injections of nanofat. It's a different discussion, so just keep that in mind. Finally, most importantly, I want to talk about threads around the eyelid. Well, what are threads? If you are hip with modern times and read the internet, you'll know there are these barbed sutures that are placed into the skin of the face. And the barbs engage the facial tissue. Then you pull it up and secure it at a higher location. So it's used in the cheek and the forehead. I've seen people with good results. I don't think they're lasting. Maybe you get 6 months out of it, maybe a little longer. There's a belief system that they stimulate collagen to get good permanent change. Is that true? Is that not true? My clinical experiences, I can't tell you for sure. But around the eyelids, I don't see its utility. And I've seen some problems and complications, and I won't get into it, but I'd be very careful around the eyelids because, again, you're spending money on something that is very short-termed. I don't think does a lot around the eyelids, and I have seen complications. Just a brief summary, guys. Hope you have a great day. DM me with questions.